I am Dr.Alim Akhtar Bhuiyan. I am Senior Consultant, Neurologist and Coordinator of Evercare Hospital, Dhaka. Actually, the Evercare Hospital, Dhaka has previously been Apollo Hospital, Dhaka. Today I will be discussing on low back pain. This is a very important topic in neurology, and it is one of the important causes of disability in middle-aged or older people. So I will be discussing on different aspect of low back pain. I will discuss on the anatomical aspect. I will discuss on the sign symptom, the etiology, also discuss on the diagnosis, how we diagnose low back pain. I will be discussing on the management part, prognosis part, how to prevent low back pain. But most important is anatomical aspect. Now I will discuss the anatomical aspect of low back pain. If you look here, this is our back. You can see the bones, the whitish are the bones. Here you can see the pelvic bone. This is the hip joint. This is the socket. Here you can see the femur. This is the tibia, and you have another bone, fibula, two bones, and this is the knee joint, and it goes down, it forms the ankle joint. Here you can see the foot. All these whitish areas, these are bones, and the yellowish part is the nerves. They actually arise from the low back and slowly goes down the lower extremities. Here you can see a plexus. Actually the plexus forms by different nerves, L4, L5, L1, L2, L3, and it forms a network, and then it goes down to make this big nerve. This is the sciatic nerve. Actually this is the longest nerve in our body. Here the sciatic nerve goes down behind the back of our thigh, and then here it divides into the anterior nerve and posterior. So different nerves are branched and supplies different parts. Actually the structure in the leg, you have the bones, then you have the muscles, and these bones and muscles are moved by these nerves. So any problem in the low back, actually we have 5 lumbar vertebra, 1 to 5. And if you look at my discussion on neck pain, you can see the location and the anatomy of the vertebrae and relation to the disc. When there is disc herniation, these nerves are compressed, and this pain goes from the back to the legs. So sometimes the pain which we get in the lower extremities, it can arise from the back actually, not in the legs. But there are other causes of pain in the lower extremities. So if these nerves are compressed, you have the back pain. So this is a nutshell description, and the motor function of the muscles of the lower extremities are controlled by the motor nerves. Then we have the sensory nerves, and if those are affected, we have tingling, numbness, and paresthesia. So motor nerve, sensory nerve. And this is our hip joint, this is our knee joint, this is our ankle joint. So different movements in these joints are done by these nerves. Now I'll be discussing on some of the causes of low back pain. Low back pain can be because of so many reasons. Sometimes we can get lumbosacral strain. This is happening in people who are younger, and this can happen because of sudden strain or sprain on the ligaments or muscles, and this pain can last for days or weeks, and it can be also because of sudden twist on the muscle, and these are mostly benign. That means it is not serious, and it will be resolved over time. If we do any neuroimaging study, it will be normal. and we can treat these cases with conservative management, like some painkillers, some muscle relaxant, some medicine for neuropathic uh, pain, and also some rest, and it will be resolved. And sometimes it does not recur. uh, Most of the time the back pain happens in people who are 50 years or above, and this is because of degenerative disease. uh, as I mentioned earlier, our lumbosacral area is composed of five vertebra, 1 to 5, and this vertebra is composed of vertebral body. They have spinous process, facet joint, uh, the intervertebral disc, which acts as a shock absorber, uh, and the spinal cord is within the spinal canal, and the nerve come out from the uh, intervertebral foramen. Our spinal cord stops at L1, L2 level. These degenerative changes of the vertebral body, facet joint, disc can cause this pain, and this pain happens because of degeneration. Sometimes we have lumbosacral spondylolisthesis, when one of the vertebral body can move forward or backward, and it can cause compression of the nerve root. Also, some of the rheumatological disease like rheumatoid arthritis, polyarthritis nodosa, or ankylosing spondylosis, they can cause pain in the back, that is the low back. Also, some of the cancer can cause low back pain. Sometimes the patients with cancer in different parts of the body can have spread of cancer or metastasis to the low back low back, and they can have low back pain. Sometimes the tumor can be primary in the back. Infection also can cause low back pain, like TB or osteomyelitis, epidural subdural abscess, or empyema. So infectious cause also can cause low back pain. Sometimes injury to the low back pain, low back, because of sudden fall or accident or any physical assault, can cause low back pain. So there are different reasons for low back pain. The symptoms of low back pain, it can cause pain in the back. This pain can be mild, moderate, severe, and it can radiate to the buttock area and also the lower extremities. And it can radiate to the lower extremities as radiating pain in the front, side, or back of the lower extremities up to the feet. There can be tingling, numbness, or paresthesia. Sometimes patient can have difficulty with holding their urine, and they can have also problem with walking in the advanced stage, and there can be atrophy of the muscles or walking difficulty depending on the severity of the disease. Sometimes the back pain is not very significant. Patient can have pressure-like sensation on the low back pain or non-specific tingling. And for diagnosis of low back pain, most important is history. We have to get the total history from the patient regarding the location of the pain, severity of the pain, radiation of the pain, any associated sign symptom, whether patient having any malignancy or any fever or any drugs of abuse or any rheumatological disease. All this will help in properly evaluating the patient. After that, we do a thorough examination, musculoskeletal examination, neurological examination, etc. After this, we can do some test, some blood work to find out any rheumatological cause or any infectious cause or inflammatory cause of back pain. And then we can go for X-ray of the lumbosacral spine. But MRI is the test of choice. MRI of the lumbosacral spine, it can show the details of the structures of the back. Especially we can see the vertebral body, we can see the facet joint, spinous process, disc, and we can see the spinal cord which stops at the L1, L2. We can see the branches from the spinal cord which exist through the intervertebral disc. That means we can diagnose different types of disease of the back by doing the MRI, whether it is infectious cause, inflammatory cause, any malignancy or any degenerative changes, etc. If MRI is not possible, we can go for the CT scan of the lumbosacral spine. Sometimes we can do bone scan to see any metabolic causes for low back pain. Sometimes we can do nerve conduction and EMG to see what is the reason for this pain in the back and lower extremities. For managing the low back pain, there are different steps. If it is lumbosacral strain, it gets better with conservative management, some painkillers, muscle relaxant, and medicine for neuropathic pain. We can do some restriction on movement or bed rest for few days. But once the back pain improves, patient can start mobilizing and then do some exercises to get relief from the pain. We have to remember, if somebody is fully restricted for a long time, his muscles in the back will be weaker, and later on he'll have more difficulty. And he also should follow certain restrictions, like he cannot squat, he has to use English commode. While praying, he should be using a chair. He cannot lift weights. He should not walk long distances, and he should not use stairs, and he should not be standing or sitting or walking for long time. He has to take rest, short breaks in between. So these are the few preventive measures for back pain. And if the pain is not relieved, he can do some physical therapy, which includes ultrasound, shortwave, infrared, or traction if required. So these are the few conservative approaches for managing low back pain, which includes medical management, following the restriction, some exercises, and physiotherapy. So most of the time, this conservative management will relieve his symptoms, and he will be better. And but in some cases, the low back pain can persist, and he has other sign symptom, like he can have intractable low back pain, which is not relieved by conservative management, and he has difficulty with walking, or he cannot hold his urine. He's having atrophy in the muscles of his lower extremities. And if we do MRI of the lumbosacral spine, he has significant disc herniation, significant stenosis, or injury to the vertebral body. So in all these cases, conservative management will not work. He has to proceed to surgical management through a experienced and well-trained neurosurgeon. So regarding prognosis of low back pain, most of the low back pain, as I mentioned, will be better with conservative management, especially lumbosacral strain. And cervical spondylosis, which is because of degenerative disease, this pain can come back and forth, or it is recurrent, and they need some treatment for short period through medical management following restriction, exercises and physical therapy, and they get better. But this can come back even after weeks or months or even years, and then you give the treatment again. But if it is in the advanced stage, patient might need surgical intervention, and that should be consulted with a neurologist prior to that intervention. And to prevent low back pain, it is important to follow certain restriction. Like if patient is overweight, he has to lose weight. He should be taking healthy diet containing lot of vitamin D, calcium, and if he is smoking, he should quit smoking. If he is using alcohol or any drugs of abuse, definitely he should slowly quit those bad habits. So, and he has to maintain certain posture always, especially when he is sitting on the chair or in the car. He should maintain certain posture. So with this activities and precautions, his back pain will not come back or recur, or he will be better off. So you can see the video link below to see some of the exercises for low back pain. So this was a brief discussion on low back pain. Thank you for your attention. I hope this will be helpful for the patients and doctors. Thank you.